This is the event that we've been working on and planning for quite some time with our Medicare Advantage contract procurement process. We have a loyalty and duty of care to the members of this plan. We don't have a loyalty and duty of care to Wall Street, to big health care, or to big pharmaceutical companies. The savings on this plan are going to be over $577 million over the term of this contract. And I know that that is a big number, but it's also a big number as we try to take advantage of our largeness and keep these plans sustainable and accessible for not just this generation of public service workers, but the next generation of public service workers. There's no design change within the plan. It is something I've been very serious about since the moment I became treasurer. Secondly, there's no premium to the member for the basic plan. And through tough negotiations with Humana, for those dependent spouses, there's no premium to them in addition to the retiree. Premium free to the member, premium free to the dependent eligible spouse at no cost to the taxpayers of North Carolina. We have an open network. Medicare in North Carolina, from my understanding, is an open network. So our members shouldn't see any changes as far as being able to go to the doctor they've been going to. We're joined today by representatives of SEANC, State Employees Association of North Carolina. They've always come to the roundtable meetings. They're at every state health plan meeting, every retirement board meeting, supplemental retirement board meeting. And just having a partner like SEANC, who represents tens of thousands of employees across North Carolina, so that we don't have to go over and explain things over and over again, because they've been there, they've been attentive, they've showed up, and they've listened. So thank you for joining us.
And this is a tremendous change for our health plan for our Medicare eligible retirees. This plan is going to save the health plan $590 million for taxpayers, as well as saving a tremendous amount of money for our retirees. Basic retirees on the Medicare Advantage plan, your out-of-pocket expense for your Medicare Advantage will basically be zero for you and your dependents. This is why our retiree council has endorsed Mr. Folwell, and we need to get out and keep him in office, because everything he has promised when he came into office, he has lived up to, and we are far better off in the retirement system as well as in the state health plan because of Mr. Folwell.
We're so glad that our partner SEANC has come in to witness the announcement of this contract. This affects our Medicare Advantage population, nearly 145,000 people over the age of 65. And as far as the plan itself and what it'll mean to the members is, from their side, we still have an open network, not just in North Carolina, but across the country. But number two, and more importantly, there's no premium to the member or to the dependent spouse. When you look at the state health plan as a whole, there's almost as many people in this plan that work for J.P. Morgan, the bank, Warren Buffett's Berkshire Hathaway, and Amazon combined in the United States. That's tremendous buying power that we have always tried to take advantage of as keepers of the public purse, whether it relates to Wall Street fees, healthcare costs, premiums, or drug expenses. Being the treasurer is not something that happens on a day once every 4 years. We are the Office of State Treasurer. I am the State Treasurer every day of every year. And being in that role means that I have a loyalty and duty of care to our participants in these plans and taxpayers like them. And I always want to focus on under-promising and over-delivering. And as you can see with the results of this contract, we have definitely under-promised and over-delivered on behalf of our members.